You'll not be the same after this talk today.
We live in a fallen world. But just because I breathe corrupt air, and rub elbows with corrupt men, never make the mistake of thinking that I am corruptible.
I won't make that mistake.
We are observing the revealing of the utmost medical tragedy of all times. Never before in history had the medical institutions deliberately produced a life-threatening nutrition deficiency in millions of otherwise healthy people. Any negative studies on statin are discouraged, and critical researchers are blackmailed, including myself. Some people cut my research funding.
That the government regulators have been bought off by Big Pharma. I think that's what you're saying when you say that this entanglement has occurred. You said agency employees are actually getting royalties, getting payments on vaccines and drugs that they approve. Is that true?
Yes, there's a couple things happening with FDA. About 50% of FDA's budget comes from regulated industries, so mainly the pharmaceutical industries. You have agency capture on steroids. The principal objective of FDA today is to serve the mercantile interests of pharmaceutical companies. And that's why you see FDA not only approving all of these drugs that should be approved, but they also are, out to destroy things that are actually shown to be good for you, that do not make profits for the pharmaceutical companies. But then,
thank you, Mr. Kennedy. Preoperative statin therapy increased risk of cardiac surgery associated acute kidney injury by 4-fold, highest with rosuvastatin. So you give the guys statin 40 milligram and then you come acute kidney failure and rhabdomyolysis, and you don't know why. That's why, and it's well studied.
We've been told that medications to lower cholesterol will save lives.
We repeatedly hear from patients that their doctors tell them, if you don't take this, you will die.
Over 40 million people worldwide take drugs to lower their cholesterol. But now there's evidence that the majority of them won't benefit.
None of those people are less likely to die.
Of course they're going to try to minimize the adverse events because that will increase the sales of their drugs.
And it's a fact, it's certainly scientific fraud, and it's a fact, it's organized crime.
Told you. Elevated CRP predicts cardiovascular death regardless of on treatment for the LDL. It's inflammation, not cholesterol, the real cause of heart disease. Embrace good fat, avoid sugar is your enemy. You could see the 3 studies confirmed risk of cardiovascular deaths were high for those with high CRP more than 2 mgl, regardless of the LDL levels. Moreover, cardiovascular diseases is due to inflammation, not cholesterol. Embrace good fat and ditch your sugar. High CRP is a powerful determinant of cardiovascular death and all-cause mortality than low LDL. FDA approved use of colchicine to reduce risk of myocardial infarction, stroke, and cardiovascular death in adult patients with established atherosclerotic disease or with multiple risk factors.
In 1961, the American physiologist Ansel Keys was depicted on the cover of Time magazine. Ansel Keys was largely responsible for the adoption of the idea that dietary fat causes heart disease. In 1984, Time magazine led with an article informing us about the dangers of cholesterol. Then, in a complete reversal, the June 2014 edition of Time led with a cover story encouraging us to eat butter and explaining how fat was falsely labeled as the enemy.
So, colchicine in chronic coronary artery disease beyond the inflammasome. So this is the 2 trial, and have shown that colchicine is an affordable, effective anti-inflammatory treating atherosclerosis. It costs less than 60 cents per month to treat you. Colchicine 0.5 milligram reduced myocardial infarction, stroke, and cardiovascular death by 25%, with 33% absolute risk reduction. None of the statin have reached that level. When composite endpoint included coronary vascularization and stroke risk reduction was 46%. And still, nobody have been prescribed colchicine.
Our top story this morning, millions of people could be putting their health at risk by following NHS guidance and taking statins. The drugs are routinely given to lower cholesterol, but a group of leading doctors has warned that they do carry serious side effects and are being overprescribed.
Sue Jameson is at Westminster Forest this morning. Sue, a huge row brewing here between doctors and ministers and the pharmaceutical industry, isn't there?
Well, certainly these are very serious allegations from this group of doctors, saying not only is the advice worryingly wrong, but also suggesting that some of those on the panel have direct financial ties, that's the quote, to pharmaceutical or other companies and could benefit themselves. Now, the advice first came out, draft advice from NICE in February.
So you could see that they're buying doctors. Statin use is associated with 50% increase in diabetes mellitus. You take statin, you become diabetic. And then you go to your GP, he'll be afraid to stop the statin because, you have to take the statin, lower your cholesterol. But you become diabetic, which is much more dangerous. Reported protective effect of statin on diabetes mellitus is the lie of the century.
They looked at over 8,000 female pensioners, right, who were on statins. And they found that those over 75 were a third more likely to develop type 2 diabetes, and the higher the dose they took of the statin, the higher the risk.
Statin is associated with diabetes progression, including greater likelihood of insulin treatment initiation, drop you back to a catabolic state with acute glycemic complication, and induces insulin resistance. Moreover, the neurocognitive pandemic, you'll find people going like zombies, you don't know what's going on. The FDA linked the epidemic of cognitive decline, dementia, ALS, and motor neuron disease to all types of statin, as FDA confirmed a 10,000-fold increase in amyloid lateral sclerosis with statin use. And you could see the publication in front of you. It's not my publication, by the way.
Cholesterol guidelines expand the number of people eligible for statins. They're decried as a big kiss to big pharma. Understandably, since the majority of guideline panel members may have financial conflicts of interest.
No benefit of any patient older than 65 years and do plenty of harm. And the perimenopausal women are the most affected with that. That's why we have the pandemic of depression, and the way of that they have major problems. Excessive risk of hemorrhagic stroke and cancer in patients with low LDL. And if you give it to anybody above the 80, he got a cerebral bleed. Spontaneous, what's happening? They forget that he was on Lipitor 80.
Studies have consistently shown that cholesterol-lowering statins actually increase the amount of calcified plaque in the arteries. Ironic for a drug that's supposed to prevent heart disease. The Veterans Affairs Diabetes Trial found that more frequent statin use was associated with accelerated coronary artery calcification. Another study published in the journal Atherosclerosis found that statins also increase the amount of calcified plaque in healthy people without diabetes. And yet another study published in the Journal of the American College of Cardiology found similar results. These studies have been quietly ignored by the medical establishment.
Chronic calcification is not linked to LDL, and loss of PCK gene is associated with increased risk of diabetes, sudden death, and higher rates of cancer. Moreover, that the trial have showed that we could potentially reduce that using a interleukin better than anything, and vascular inflammation is stronger driver of residual cardiovascular event than cholesterol.
I honestly don't believe that doctors do recognize statin side effects, even when they're sitting right in front of them. In the middle of my 2-year illness, I saw my internist for our annual check. After briefly noting that I was seeing several specialists for my dry eye problem, my arrhythmia problem, my colitis problem, and my depression, she then got to the heart of the visit, which was that she was delighted that my cholesterol levels were under control. I find it ironic that neither she nor I ever stopped to question why a relatively young, healthy person had suddenly developed 5 new illnesses in 1 year. And the only new thing in my life was Lipitor.
Cardiac harm was confirmed with PCK and is associated with risk of neurocognitive impairment. And just going in the sake of timing, Mr. Chairman, ladies and gentlemen, promoting statin for primary prevention is risky and cause significant harm without any clear benefit. Statins are seen as a failed experiment carrying severe pessimistic generation consequences for primary prevention. Statin leads to accelerated atherosclerosis in people without elevated LDL with worsening of their cardiovascular health in primary prevention. Statin offer minimal benefit of 0.5 absolute risk reduction in primary prevention for women of any age and men over 65 and zero benefit in children, questioning the widespread use in primary prevention. Lipid hypothesis created the war on fat and cholesterol, which combined 65 years of global human experiment. Statin is acknowledged as an awful failure, an experiment that has atrocious, unbearable, dire, nasty, shocking, repulsive generation consequences in primary prevention. Thanks so much for the opportunity to present today.
Sherif, do you take statin?
Definitely not.
Okay.